Hello, I'm Dr. N.R. Ichaporia. I'm a neurologist in Sahyadri Hospital, Nagar Road, Pune. Today, I would like to talk to you about a very common neurological illness, that is epilepsy. Now, epilepsy is a very wide term which is used for, in general language, what is called as fits. So, this particular disease occurs in about 1 to 2% of the population. So many people in the world suffer from epilepsy, and it occurs in all age groups, right from early life to very old age. And depending on the age of the patient, the causes of epilepsy are different. So childhood epilepsy, the causes are varied. It could be because of injury to the brain during birth or some metabolic disturbance like low sugar or low calcium. And as age advances, the causes differ. And in childhood, the causes are mainly genetic. And as adulthood comes, there are secondary causes which could be genetic, or there could be a tumor in the brain, or a small calcified lesion in the brain, or cysticercus, which is a tapeworm, or TB, or after head injury. So depending on the cause of epilepsy, the treatment will differ, and we need to therefore investigate every patient of epilepsy to determine what the cause is. There are very many investigations which can be done, from routine tests in the blood to more specialized tests like MRI scan and CT scan, and doing also the electrical test of the brain called an EEG. EEG is like you put electrodes on the surface of the scalp, and like an ECG, it records the electrical activity of the brain. And this can give you a lot of information about the causes and the treatment of epilepsy. Now, depending on the cause of the epilepsy, the treatment will differ, and so will the prognosis. We have now a wide variety of drugs which can be used to control epilepsy, and a large percentage of patients can be treated extremely well, and they can be controlled with epilepsy for a long time. The important thing is that the drugs have to be taken regularly without even missing a single dose, and have to be taken for a prolonged period of time. Because of this, many patients default on the drug therapy, and therefore the epilepsy can recur because they stop drugs. Many of these drugs also have some side effects, so we have to monitor the patient regularly and see that they are taking the drug, and also monitor the side effects of the drugs. Unfortunately, because of the chronic nature of epilepsy, there are many stigmas or false beliefs attached to epilepsy, and many people suffer from the social consequences of having fits. Especially in women, this problem is very acute, because in childhood also, the child is not sent to school, he is not allowed to play with other children, he is not allowed to go for picnics, he is not allowed to swim, he is not allowed to climb trees, he is not allowed to cycle. So many restrictions are put by the anxious parents on the children, and this hampers the development of the child, his psychosocial development. As the person becomes older, there are questions of education, there are questions of getting married, there are questions of holding a job. Many people find it difficult to get married, because if they disclose that they have epilepsy, the opposite party refuses to go ahead with the marriage. So this is another very important problem in our country. However, we advise people to continue with their normal education and have a normal married life, they can get married, they can have children. The chances that their children will get the epilepsy is extremely low and negligible. So we must encourage normal development of the person. Also, they can hold jobs which are sedentary and which do not involve driving or climbing on heights or working with moving machinery. So, or nor can he fly a plane, nor can he do some very active sports like bungee jumping and other dangerous sports. In India, the problem of driving also comes because the laws are very difficult in India, and the laws in India say that if you've got epilepsy, you cannot drive forever. Now, this law also needs to be changed over a period of time, and if you are controlled with epilepsy and the drug therapy is going on, I'm sure you can drive and lead a normal life. So it's very important for us as doctors to see not only that the epilepsy is controlled and the drug therapy is taken properly with minimal or no side effects. This is very important because many people suffer from side effects of the drugs. And also we have to ensure that there is good social integration of the patient into society. However, there will be cases, about 10 to 15% of cases, who do not respond to drug therapy. For them, we have more advanced therapy like surgical therapy, which can remove the lesions of the brain from where the epilepsy is arising and make life more easy for the patient. And many such patients who have undergone surgery after detailed examination and detailed testing have done extremely well and have integrated beautifully into society and have led normal lives. So the outlook for epilepsy in whatever form is extremely positive, and we as doctors should see the positive part of epilepsy and try to integrate patients well into society so that they can lead full and normal lives. Thank you.